So today we have a distinguished guest. He is a colleague of mine. His name is Raphael Assayag, Dr. Raphael Assayag. So we've been working together for more than 15 years. So tell us about yourself, Raphael, because we're going to talk about a very specific topic today, which
Yeah.
is um, hormone replacement for menopause, perimenopause. So, what type of practice do you do?
So I'm a family doctor. I've been working as a family doctor here for 17 years, as you know. I work in private practice for the last year or so. So I have an interest in all of family medicine in all the topics, but I've developed a specific interest in weight issues, but specifically also in menopause, perimenopause, hormone replacement. In the last few years, I've done a lot of research and got training, and I'm really interested in this topic.
So, as as you know, and as what we see in our office is, a lot of women around menopause um, feel different symptoms, and sometimes they're kind of lost because these symptoms are atypical, non-specific, and they're not sure whether it's due to menopause or not. So, what kind of problems do these women come to you with?
It's menopause is a period, or perimenopause is a period which can last several years,
Mm.
and it's often not recognized. Menopause means no more periods, right? The menstrual cycle stops.
Yeah.
The production of hormones, estrogen, progesterone stops. But for years prior to that, it's a long process. There's a slow decline in the production of hormones, and that comes with a lot of symptoms. Not for everyone, but for a lot of women. A lot of symptoms. Sometimes these symptoms are not even recognized as hormone symptoms,
Related,
if you
yeah.
hormone related symptoms. And so obviously by the end we start seeing irregular periods, skipping periods, but way before that, women will start noticing changes in their metabolism, changes in their body composition, changes in their
Sure.
mood and their sleep,
A
and
lot
their
of women
libido.
come to see me telling me, Doc, I've gained weight. And as soon as I ask them why, they say, well, menopause. Like it's typical. Typical.
Absolutely.
So you're talking about mood swings, you're talking about
Sleep issues,
hot flushes.
libido, hot flashes, joint pain,
Yeah.
concentration issues, a constellation of these symptoms, which individually can be caused by various problems. But when you look at everything together, often it points towards uh, premenopause.
So thankfully, there is, some help for these women because sometimes these symptoms can be quite severe and debilitating.
So,
So, what kind of treatment do we have to offer for you?
so quite distressing for a lot of women. You're very right. Some of these symptoms, not for everyone, but for women who suffer, it's very distressing. Um, the best treatment there is, and it's recognized now, it's hormone replacement therapy. As you know, there are other treatments, there are other medications or non-pharmacological tools that we can use to alleviate some of these symptoms. So whether it's hormonal or not, but the most effective treatment there is hormone replacement therapy.
For estrogen and progesterone for most of patients.
For most patients, now a lack or a decline in the progesterone production causes a set of symptoms. A decline in the estrogen production causes a different set of symptoms, and they often come together at different times. But yes, hormone replacement therapy, and today we use what we call bioidentical hormones,
Yep.
which are the standard now, the gold standard. Very effective with very well tolerated with minimal side effects. So.
So, a lot of physicians, a lot of GPs, family physicians like me, are confronted with patients that have these symptoms, and some of these symptoms sometimes can be non-specific and can be due to other medical reasons, whether it's thyroid dysfunction or problems. Um, and a lot of us family physicians are a little bit lost in helping these patients. We don't specialize in that. I know that I have an easy way. I refer my patients to Raphael. So tell us about your program. Tell me what you do with the patients that come to you. How do you manage them?
Yeah, so as you said, it's like it's not because I like to look at menopause and hormones that everything is related to that.
Right.
So we like to do a full evaluation, obviously.
Yeah.
The first thing I do when I meet someone is we really look at the overall health. So I'll make sure to look at their medical conditions, which medications they take, their lifestyle, because there's a big relationship between lifestyle, exercise, smoking, sleep habits, etc.
Sure.
Family history, risk factors, and then we take all of this together and we look to see based on the symptoms if there's a match, if perimenopause could be a cause for these symptoms. Now we also do blood tests.
Yeah.
And there's ways to measure the hormone levels, right?
Right.
If you're menopause for 2 years and you haven't had a cycle, we know what your hormone levels are. They're very low. But for a lot of women in that pre or perimenopause period, it's important to do a blood test to measure the level of hormones and to confirm that we're looking at it the right way.
So on one hand, you try to eliminate anything else that could cause these symptoms.
Absolutely.
And once you have this diagnosis and you engage into a treatment, you mentioned before you can give hormone replacements or you can give, non-hormonal treatments. Tell me about the response of patients. How do they feel? What kind of response do you expect?
It's actually quite impressive. A lot of women get very, very quick relief of some or all of their symptoms.
Yeah.
It can be a matter of days, 2 weeks. Obviously, we go slowly. We always go slowly. We prescribe slowly. When we identify the problem correctly, then we fix it, and it's much easier. If there's no response, often it means there's something else going on that we need to look at. But usually it's very effective, quick relief, and women are quite impressed at the change.
That's what I see with my patients when their symptoms are really related to perimenopausal, menopausal issues. Once they go on hormone replacements, they really respond very well and they feel great.
Absolutely, and I like to remind women that menopause is a normal and natural process, right? It's not a disease. It's not a problem. It's totally normal. But it's not because it's normal that there's no distress. It's not because it's normal that there's no symptoms and that we have to accept it like this. And that's a big relief for women sometimes to hear that, to realize that there are things that we can do about it.
It's funny, as you know, I do a lot of weight loss myself. I see a lot of patients we have a very large weight loss program here, and I see a lot of women that come to us with excess weight, and typically when I ask them, why do you think menopause is always up there as a top reason? Something else I'd like to touch, some women sometimes are a little bit refractory on taking hormones or concerned or, about potential cancer and this and that. So what would you say to these women that are a little afraid of being on hormone replacement? Is it justified?
So there's been a lot of back and forth over the last decades, right?
Controversies.
Controversies. If you look at 30, 34, 35, 40 years ago, most women were on hormone replacement therapy.
Absolutely.
Came a study, the Women's Health Initiative, which was very
about
controversial.
17 years ago, more or less.
Right.
And it started to shed it out.
All of a sudden, women were being told, don't take hormones. You got to stop your hormones.
Yeah.
Doctors were being trained, that way also, and that's also why, myself when I was a resident, when I trained, it was in that period where we were moving away from hormone replacement therapy.
But further studies have come along, and the
Absolutely.
pendulum has shifted nowadays.
Today,
Yeah.
the overwhelming evidence and most studies show that it's very safe. Now, side effects, always. There can be side
Potential.
effects. That's
Potential, yeah.
it's true. But it's very safe, and it's right now we don't have to hesitate. For the vast majority of women, it is considered a good option.
But even for side effects, in my practice, I don't see too many side
No,
effects.
no.
They're very rare
There's-
from what I see.
There are potential side effects, like with everything, but the vast majority of women tolerate these medications or these treatments very well.
Something else I'd like to touch. You mentioned to me when we were talking before filming. You mentioned that you offer patients a free consultation before embarking in your program. So I'd like you ladies to know that if you do have any symptoms of menopause and you're wondering, what can you do? Well, Dr. Assayag offers his patients a free consult initially, more or less to see whether you could be a candidate for treatments. Because, as he mentioned, you could have other reasons to feel these symptoms that are non-menopausal related. So that's a big advantage. We appreciate that. I know when I refer my patients, they enjoy this. Thank you very much. Really
Pleasure.
appreciate.
Thank you.
And I think this is a very important treatment that helps a lot of patients that have suffer from these symptoms.
Absolutely, game changer in some cases. Absolutely.
Agreed.